know, okay. As many of you know, Evanston has been a leader in public health. Related to tobacco alone, we were one of the first communities in Illinois to pass a Clean Air Act back in 2006, a year and a half before the state Smoke-Free Act of 2008. Moreover, Evanston was the first community in the entire Midwest to pass Tobacco 21 in 2014. This measure sought to protect our youth by raising the age of sale and purchase of tobacco products from 18 to 21. The second Midwest community to do so was Columbia, Missouri. But following Evanston were 23 local communities. And finally, after 5 years, Illinois passed Tobacco 21 in 2019. Pertaining to Black History Month, Evanston, like many communities in our country, has shared a checkered history of racial injustice. But in 2019, our city created a reparations fund using revenue from legal marijuana sales. We are so proud that Evanston received national attention as the first city in the nation to establish a program to pay reparations to some of its Black residents for past injustice. Now, linking tobacco, public health, and racial justice, tonight's topic is titled "The Flavor of Defeat: How Big Tobacco is Still Winning in Evanston and What We Can Do About It." However, let's begin with a national perspective from our honored guest and national expert. Ms. Carol McGruder is a seasoned veteran of California's tobacco control experience and a founding member and co-chair of the Afro-American Tobacco Control Leadership Council, the AAA TCLC, which was created to inform the direction of tobacco control policy, practices, and priorities. The AAA TCLC works at the intersection of public health policy and social injustice. They have resolutely fought against decades of racialized tobacco industry targeting of the Black community and the resulting 45,000 Black lives lost each year from tobacco-induced diseases. Their council has been at the forefront of the national movement to restrict the sale of mentholated tobacco products by assisting communities across the country to take action, as Carol is doing this evening with us in Evanston. Moreover, and no small task, in 2020, the Afro-American Tobacco Control Leadership Council, along with Action on Smoking and Health, the American Medical Association, and the National Medical Association, filed an administrative lawsuit against the Food and Drug Administration for its failure to take mentholated tobacco products off the market. The lawsuit prompted the FDA to declare that it will begin the arduous rulemaking process this year in 2022 to finally take deadly menthol and little cigars totally off the market. We'll see. Maybe with the new FDA commissioner finally approved yesterday, action may move forward, we hope. Now, finally, Ms. McGruder and the Afro-American Tobacco Control Leadership Council is currently working with other advocates to fight back the tobacco industry's referendum on California's Senate Bill 793, a statewide menthol sales ban that would have gone into effect January 1st of last year. Carol and the council have received well-deserved accolades from many prominent organizations, including the Public Health Law Center, the American Legacy Foundation, and the San Francisco and Berkeley branches of the NAACP. In fact, Ms. McGruder served 2 terms as NAACP's Berkeley branch president. So tonight, Carol will share the latest tobacco industry tactics for dodging regulation and expanding its markets by targeting youth and communities of color to initiate smoking in order to what? To ensure a new generation of lifetime customers. So it is indeed my honor to welcome Ms. Carol McGruder to Evanston via Zoom tonight. The time is yours now, Carol.
All righty. Well, thank you so much. Good evening, everyone. It's my absolute pleasure and honor to be here. In our pre-meeting, Dr. Ziegler educated me about the importance of Evanston, so I was very happy to learn more about you. I've read about you, but I didn't connect. I read about the reparations when that happened, but I didn't connect that that was with you. I want to just tell everyone that my mother was from Chicago, and even though I was raised in California my whole life, I definitely have a Mississippi, Chicago sensibility in everything that I do, and that when I had the opportunity to go back there, and myself and Dr. Val, who's on the line, when we were working upon Chicago, I just felt so at home. So I know that I would also feel at home in Evanston, and will definitely come back there when I get back your way again, God willing. So right now I'm going to share my screen. And tonight I always am cutting slides. I always have too many slides. So I'm going to take my time and just talk to you about the importance of cities and the importance of people like you on this call, because we are the ones that make it happen. And even though we're fighting this billion-dollar foe that has tentacles everywhere, we have tentacles everywhere too, because there are good people everywhere who are willing to do the work that we need to do, and that we absolutely can do this. And so we have fought so hard. So this is our council. We had to learn ourselves. We call it AAT-CLC. So this is the African American Tobacco Control Leadership Council. We were formed in 2008, and were really formed in response to many of the state budget cuts we were experiencing as party populations. So not just African Americans, but the other party populations as well, Latino, Hispanic, LGBTQ. And at that time, the leadership groups of our party populations were they weren't defunded, but they just weren't refunded to continue on. And it left our state with a body, but no head, no brain, no cohesive strategy, no people sitting together, working out how this thing was going to roll out. And so the people on this picture, I'm so proud and honored to be the co-chair, because most of them are still there after all this time. Most of them are unpaid. We didn't have any funding when we started, and we've been meeting every month for at least 10 months out of the year since 2008. So this is such a dedicated group of people. And even though I and Dr. Valerie Yerger and Dr. Phil Gardner, we're kind of the national face of the AAT-CLC, these are the people who are with us, working with us. We're very different. We all have different views, but we come to consensus, and we have, we all have been at the helm of this fight to get mentholated tobacco products off of the market in the United States of America. So I'm going to start with this. So this is our virtual signing, COVID, of the California state bill to take flavors, menthol cigarettes off the market in the state of California. California was the second state after Massachusetts to do this. So this was August 28, 2020. You can see me there right under Mayor Newsom's hand. And he used to be the mayor of San Francisco, which is my city. So I actually saw him kind of grow up before my eyes as a supervisor, become the mayor, then go on to become the governor. And I know he has some presidential aspirations as well. So, we jumped on Zoom after this hard fight to get this thing passed, and he signed it, right away. And we were all so encouraged. So you see these happy faces. There's Phil there. I don't know if Dr. Val, because this was kind of impromptu, so everybody got on who could. So these are, we have to celebrate the days like this, because we know there will always be pushback. There will always be a fight back. And that's part of this process. And so that's what we have to understand. And that as we win, we need to be thinking about, how do we keep the ground that we gain? How do we hold on to what we win? Because they're always going to be there to undermine it. They're always going to be there to sabotage it. And so we're not doing our proper planning if we're not thinking about that all along the way, along with implementation all along the way of what we're doing. So we know that smoking and tobacco-induced diseases, they kill 45,000 African Americans every year in this country. And that's more than every other thing that we think of as a problem combined, every other preventable form of death. And so this is a graph to demonstrate that whenever I go to any cities, especially Chicago, when I turn on the radio or the news in the morning, I hear about what Black or brown man was murdered the night before. That's everywhere I go in this country, unfortunately. So even though the homicides are what capture our attention, break our hearts for various reasons, when we look at the sheer numbers of people who die from tobacco, of course, it has to be a priority for our community and everybody's community in this country, because we all are Americans here, and our lives affect each other's lives. So this is a graph that I show, and when I show this to my community, people, used to their mouths would drop open. Now, because we've done so much work and so much education and engagement, people are getting it, they understand it, they know it. But not that long ago, their mouths, they would be dumbstruck because they couldn't believe that 45,000 Black people are dying every year, but yet we heard so little about it. There was so little fight about it. And these other issues that we think of as issues are issues as well, but they, merit all to be, we have to deal with them all at the same time. And that's the message, is that we can't wait till we deal with officer involved shootings or all the other ills that we have. We must deal with tobacco at the same time simultaneously and keep it in our top 5 priorities as a community and elected officials. So addiction. This is a wonderful movie. Dr. Ziegler, if you haven't recommended your students to see it, please do. And this Addiction Incorporated documents how the tobacco industry researched how to make cigarettes more addictive, and knew that nicotine was addictive before our government caught on to it. And it has some of the key players in the fight against the tobacco industry. It's real engaging. They use animation to show how they got the rats addicted. And the beauty of this film is that it really helps people to understand that addiction is not about personal weakness, or it's not about willpower. That being addicted to something is about your brain chemistry. It's about these substances are actually changing your brain physiology and anatomy and building receptors for whatever the substance is that's addicting you. And so, and people need help when they become addicted to a substance. So we saw in our country the different response to the opioid epidemic. At first, there was a similar response of criminalization for addiction. And that's what the Black community faced with crack and with heroin. Nobody helped us, nobody understood us. They just want to lock people up who were addicted, and the behaviors that addicted people do when they can't get the substances. So this film is a beautiful film, and that it really helps to explain what addiction is so that people can really understand. And I think for people who are addicts, that it helps them not to feel so guilty about being addicted to something, and helps them to process what's happened to them in a different way. And so it's good for nicotine, but it's also good for any addiction that people have. So addiction is about chemistry and access to populations. And so in the tobacco industry, sows addiction in our community. And when we think of addiction, we don't think of addiction as a communicable, as a contagious disease. So we've been living with COVID. We wear masks, we do all these things, but when you create a toxic environment where it's the norm to go to your corner store and to see all these products, not just tobacco, but all the other things that are no good for you, that are in every store in a Black neighborhood in this country, no health, nothing good in those stores, then you're creating contagion, that becomes the norm. So community norms are contagious. And that's part of what we're fighting for, is to change our community norms. So people are like, well, that's not going to help, but it does help when you take these products offline, when the retail stores are not the advertising vector for these deadly addictive products, where we don't have the advertising at eye level for children when they come in to get candy and see that their whole lives. And then of course, when they're about 12 or 13 or 14 or 15, then they're going to try these products that are the norms in their neighborhoods. And so when we talk to our community folks who've experienced this, as I have, I grew up in Baby Hunters Point in San Francisco. As a teenager, I bussed myself out to a better neighborhood. So I rode past all the liquor stores in Baby Hunters Point, where I grew up, all the liquor stores in the Fillmore, the Blues District, Jazz District of San Francisco, out into the pristine avenues where there weren't any even corner stores around the schools. So seeing that difference from 14 to 17, really put it on my mind, the difference that a neighborhood makes in terms of just how you feel about your life, how you feel about yourself, and how you feel about your community. So we have the law passed in California in 2020, But it started before this, but this in 2009 was a milestone when President Barack Obama signed the Family Smoking Prevention and Tobacco Control Act. And at that time, he gave the FDA the authority, this act did, gave the FDA the authority to bring the tobacco industry under their purview and to regulate them. At that time, all of the flavors for combustible cigarettes were taken out, but menthol was left in. And so this is another lesson for the people on this call, because it's a few people. So when this thing was going down, Dr. Val was working at UCSF, University of California, San Francisco, and she started talking about they're exempting menthol. And so we're busy working, doing all the things that we do. And I'm thinking, well, whatever's in the bill, it's too late now. How are we going to do anything about it? Because this thing was passing through and going to be signed into law. So she agitated and called around. We're in California. She called NAPTN, our National African American Tobacco Prevention Network. And that began the process of examining menthol, and the fact that menthol was given a pass and was exempted. And from that agitation, along with others, we got an amendment to the Tobacco Control Act, and that was passed, that was sanctioned by the Congressional Black Caucus. And so the Congressional Black Caucus, their foundation, a lot of them, they take money from the tobacco industry. Some of them are from tobacco states. But at that time, Dr. Donna Christensen, who was the representative from the Virgin Islands, who's a medical doctor, managed to get this amendment that gave TPSAC, gave the FDA on their to-do list that they had to do something about menthol. And that amendment set the stage for this huge fight that we have had since 2009 about menthol, because they were mandated to do something. So initially, and this is a thing, we're in California, this was a huge thing to us. So when the first meeting, we're all tuning in, it was webcast, and there was nobody there. So we thought all the tobacco control advocates who were out in Bethesda, DC area, it would be packed, but there was nobody there. And at that point, myself and Dr. Phil Gardner, Dr. Valerie Yerk was actually commissioned by the FDA because she studies the tobacco industry documents. So she was commissioned by them to study what they knew about menthol. I went back as a little poor Black woman on my own money to hold the umbrella, hold the place for us African Americans and the other party populations who were not represented, to talk about menthol and doing public comment. And I went back probably maybe 4 or 5 times until they announced their research agenda, the formation of the TCORs, the Tobacco Centers of Regulatory Science. And there was nothing in the research agenda that pertained to Black people. At that time, cannabis was still illegal in most places. I asked, what about blunts? Because we've been fighting about these blunts forever. And blunts is when our young men would put marijuana into these tobacco leaves and smoke them. And that had been going on for decades. And so, and we're seeing the result of that as well. So that all that is to say is that we began to engage the FDA about menthol from the very beginning, and we were very angry about it. And so as TPSAC, as the FDA commissioned the reports, and then the other thing was the industry, because of the way our country's set up, they have a seat at the table. So they can't vote, but they're there to get all the information. They're there to delay, to challenge, to sue, which they did. Meanwhile, the community people, we have to clamor, to be heard, doing the 2 minutes doing public comment. We don't have a seat at the table. So that anger and the inaction over the years just began to really, we were seething with that. And at one point, we actually considered having civil disobedience before Obama left, as ACT UP did, if people know about AIDS. And initially, our government was very slow to react to AIDS, the AIDS epidemic. So we were going to go and lay down in the street in DC, me and Phil, and we had Sharon Eubanks, who's, Department of Justice attorney, was going to bail us out, or Del Monte. But luckily, we didn't have to do that, because Chicago, your neighbor, they broke bad and they did something about menthol. So I'm getting ahead of my story. But anyway, so that's your neck of the woods of change this whole scenario. So when they excluded menthol, it was not based on science, but yet everything they were saying, and we're going back, let the science lead us, let the science lead us, because they know the more they study, the more they delay, the more people are addicted to these products, and that's all they do. So our question was, who would protect Black children? If we're protecting kids from flavors, who's protecting the Black kids with menthol? Because Black people are not just born with the menthol in their lips or in their fingers. We grow up, we're children like everybody else. Who's going to protect these kids? Who's going to protect these kids? Who's going to protect these kids? Our teenagers, our adolescents, who have so many things to deal with, to being Black kids in this country. Who's going to protect them? Who? And that was our question to our government and to our community, some of whom are complicit with the industry. Who's going to protect this child? And so when we're doing our work with the retailers, you'll hear the comments that, this is an issue of bad parenting, and that, their kids are raised in these stores, they're not using these products. And so the kids that are using them is because of bad parenting. And so the vaping epidemic set that comment on its heels, because they went after, the e-cigarette folks went after the soccer kids and the advanced placement kids. Those were the kids that in that first wave of vaping that were hooked. And we're going to talk about PAVE in a minute. So our position is that this child needs more protection than other people do. Maybe his parents aren't the best parents in the world. Maybe they're whatever. You can look at him and see that he's had a hard life. So he needs our protection more than other children, and we need to do all that we can so that he can get to the other side of his childhood relatively whole. So we call this trickle-down public health policy, where you're protecting the people at the top who can advocate for themselves, who can fight for themselves, who aren't distracted by trying to survive. And it trickles down to those folks when you protect the people at the top. So this is an abstract that we submitted to Singapore. So, and Ash is on the line, Chris Bostic. So we were taking our case out of the US from the beginning. I'm a traveler, a gypsy. So, we're going to shame our country. So this abstract was called The Least of These, and US policy in African Americans and menthol cigarettes. And it documented what everyone knows, how we've been so perniciously targeted, how there were programs, retailer programs for African Americans. Cigarettes were given away literally for free, how they co-opted our leadership groups, our media, Jed, Ebony, those are also Chicago-based publications. And so menthol is a human rights and a social justice issue. And this is Marie Evans. She's our poster girl. She was given Newport cigarettes at 9. Addicted at 13, dead at 54. This woman, if she were alive, we'd be the same. We're the same age. And so I consider myself to have a lot of living to do. I have a lot of people needing me to be alive at least another 20, 30 more years. And so the fact that when we're snatching people at 50, which is very young, that when they're just getting to the point where they can really help their families and communities, they're settled in their lives, and then they're gone. The importance of Black grandparents in our communities, the role that I play, it's a different stage of life, and you have the big picture when you're helping your children and your grandchildren, and that's what the industry steals from us. So this family, they actually settled. They received $79 million, and so some of this conversation needs to revolve around reparations, around health equity and the health that's been stolen from us. So this is PAVE. These are my sisters. They started Parents Against Vaping. These are the mothers of the children who were addicted in that first wave of e-cigarettes. And so 2018, they formed. Their slogan is "You mess with the wrong moms," and they did, because they have been getting it done. And I'm actually on their advisory board, and we do work together. But my challenge is that the menthol targeting has been going on for decades in our community. And this is a hearing on Jewel that happened in 2018. You can see myself and Dr. Val there to the left, in the left corner. But we've yet to have any kind of meaningful congressional hearing just on menthol cigarettes and African Americans. So this was the head of Jewel, Carter on the carpet, of all the mayhem that he's been, sowing around this country. The Attorney General sued Jewel. North Carolina has already received $40 million with the understanding that if any state gets better than that, they'll get better. So what have Black people gotten from the industry for all the harm that they've committed on our community? So, this is an issue of social injustice. We know the industry, they target everyone. That's their specialty. They segment people out, but they are particularly pernicious in the way that we have been targeted. It's racialized, it's racist. The fact that we have so many other issues to deal with, and that they knew that tobacco would be pushed to the back burner, which it continually is. We've been facing the police reform, George Floyd, all of these issues. And that's real, and we must deal with that. And that's one of the arguments that the industry now flips on us, to say that it's racist to take menthol off, and that if we do, it's going to increase officer interactions with Black and brown men in this country. So we're often the bargaining chip in the public health policy negotiations, but doing nothing is not an option. So when people tell you, it's racist, the unintended consequences. Well, the intended consequences are the 45,000 Black people that die every year in this country. So this is a graph, and I have some more recent information. This is a graph from a study. And so now this was 2010 to 2050. So now we're in 2022. But if just 30% of people had stopped menthol at that time, we would have saved 633,000 lives, of which 237,000 would be Black. So just that disproportionate number, because we're 10% of the population, so that the number of Black people saved should be 63,000 and not 237,000. So that just demonstrates how successful the targeting was of Black people, and how we disproportionately smoke mentholated tobacco products, because we're not the only ones that do, but 85% of Black smokers who smoke menthol. So this is an op-ed with Dr. Val, who joined us. And she wrote this op-ed in response to this research paper, which is the latest research that we have that documents the harm that's been caused by a match made in hell. So this is the lives lost of Black folks. And I'm just going to read that because from 1980 to 2018, we have 1.5 million new Black smokers. We've had 157,000 smoking related premature deaths, and 1.5 million life years lost among African Americans. And so that is the latest research that we have. And we're going to be actually doing a webinar with them on their research to really dig into this deeper. So this is recent, and this is something that you can use when you're talking about this issue. So, African Americans are used as a tool to blunt public health for everybody. There's nothing, when Canada banned menthol, they didn't talk about, Canada has Black people too. The European Union has Black people too, but that wasn't part of the conversation about public health. Was we got to leave these products on because our Black people want them. And Black people want a lot of things. So why don't they give us some things that are healthy and good? Why are they trying to give us something that's going to kill us? So one of the things that the industry does is they use African American people to carry their water. I'm checking on my time here. So one of them, surprisingly, is the Right Reverend Al Sharpton with NAN, the National Action Network. So he receives money from Reynolds American International, which is a wholly owned subsidiary of British American Tobacco, which owns Newport Cigarettes. And he's one of the prime people who talks about that this is going to criminalize us. He uses Eric Garden, who was killed in New York for allegedly selling loose single cigarettes because the price is so high, the taxes, which we support increasing taxes. So he was the catalyst, the spark for I Can't Breathe, Black Lives Matter. Said that, the fermenting cauldron. This was, like the spark that was like, just got people so angry. One of the videotapes. So we got, if you ever looked at the whole tape, it's pretty awful and disturbing. So this is a reality. And this is what they say is the unintended consequences of interrupting the addiction chain and taking menthol off the market. This is a more recent example of that police officer involved altercations. This is Northern California near Sacramento. So this was in 2020. And then promptly the next day, there's a newspaper article in the Sentinel, which is one of our biggest Black papers on the West Coast, about, this is what's going to happen if we take these products offline. When in fact, this boy was 14 doing a buddy buy at a 7-Eleven. And so if the product wasn't in that store, then he wouldn't have been there. But nevertheless, we have to deal with this. We have to deal with this is a close-up. So he was just a slight boy. So this is heartbreaking, of course. And so as horrific as the video is, the real targeters, the real killers is the tobacco industry. So they don't get a pass because we have a problem with racism and policing of Black people, Black and brown bodies in this country. The tobacco industry does not get a pass to keep killing 45,000 people every year and addicting another generation to replace them. This is something that's very serious that we have to deal with simultaneously. So these are the boys I keep in my presentations. Trayvon there to the left with the smoke. This was the picture from his Facebook fooling around that the media kind of used to assassinate his character, the thug, that he's a thug. And so this is real, and it's something that we must deal with, as I said. So this is one of the latest boys that broke my heart. Elijah McClain, nothing to do with tobacco, just was a special needs boy walking home from the store and attacked and killed in Aurora, Colorado. So we need justice for these incidents, but we also need justice from the tobacco industry. This was Philando Castile. So before George Floyd, Philando Castile was killed in Minneapolis driving. Pulled over with this girlfriend and a baby in the back seat. But the picture there of the Newports is what I zeroed in on because she's mediating her stress. And that's part of the issue with the nicotine and these cigarettes. So many folks, it's about stress. And so we're really approaching this more holistically and working on the big picture of how do we get our people off of these products and not just simply take them off the market. So there's Rahm Emanuel. So that's 2013 when things begin to change. So we didn't have to go and lay in the street in Washington, D.C. and get arrested. Chicago just jumped bad, and they had enacted at the buffer zone, which was only a 500-foot radius around the schools that you couldn't sell these products. That was huge. So we're back there. You see myself, Phil, and we actually gave him an award. So Chicago did it. The industry sued them. They litigated it. And that set the stage that cities and municipalities do, in fact, have the authority to say these products cannot be sold in their municipalities. And since that time, then, it's been dominoes across this country. So Berkeley, this is me. I lived in Berkeley at the time. This is when I was president of the NAACP for Berkeley. We promptly brought it to Berkeley, got the buffer zone passed, a very progressive city. And that began this domino. So San Francisco was our first big major city to do it. And I lived there, Dr. Val works there, and we had a lot of community support and had been working on this all along. So it looked like, we had a little community engagement grant. We did it in 1 year because we'd already been doing the work for years and years. So Malia Cohen there, she's the supervisor from the district where I grew up. So I was really able to speak from my heart about what I experienced growing up there and the difference, since I did get around to other areas of my city, the difference in my community where I grew up in other areas of the city. And we had our police chief, Chief Scott, William Scott, to help to counter the issues around policing, that this is not about individuals. This is not about a brother standing on the corner and the police say, are you smoking a menthol cigarette? That's not what we're talking about. We're talking about not legally selling these products in our city. We had the NAACP there, and this is something, the Delta Sigma Theta Sorority Incorporated, they were the first national group to pass a national resolution, basically when we were still trying to get the FDA to do something. And so that when Delta speak, people listen. And so they passed other resolution system, but this was the beginning. And they come out and they testify. So this is important to having that true community engagement, of having reliable, credible spokespeople who know their communities coming to talk about it. The NAACP, which historically had taken money from the industry, passed a national resolution in 2016. And they stood by that. They're standing by California's statewide referendum because that's on the ballot. So and when San Francisco signed the law, this passed, and Ed Lee signed it. The industry promptly dumped $11 million to fight San Francisco. San Francisco is a very small city. And so there was, advertising everywhere, but San Franciscans stood firm, and they voted 68% to 32 to keep the law. And now there are no more Newports and flavored tobacco sold within the city of San Francisco. So that we're back to California now, to our statewide. So in this statewide fight, And what was interesting about San Francisco was Oakland, which is across the bay, was also looking at a law. Oakland has 30% African American. San Francisco really just has 5 or 6%. So the media for San Francisco was, we're a liberal city, people can do what they want, adults do what they want, adults like flavors, this isn't about kids. Oakland was, they're going to kill the Black man in the street if we take menthol off the market. So just, one bridge ride, the difference in the media showed how the racism is used to get the votes that they want. And so you can expect that. So back to California then. So this was actually a protest, the vote for 793, a protest in Los Angeles and in Sacramento, the capital, the day of the vote, where they got homeless people, poor people, and paid them to come out to protest that this was racist and discrimination. And so I had many people calling me to say, what's going on with this bill? Is it racist? Is it discriminatory? So the racism and discrimination is, of course, the industry's targeting of Black people for all these decades. That's the racism. This is Shirley Weber. So when I send you my slides, this is a video. At the time, she was the chair of our legislative Black caucus for the state of California. And she came out so strong for Senate Bill 793. She came out so hard against the targeting and how the industry was trying to say that this was a part of our culture, menthol cigarettes. And she's also a professor of Black studies. So she is one of the best speeches I've ever heard about this issue. And that's something that it's on our website and on our YouTube channel. So this law, promptly when it was signed, then the industry's collected signatures. So now we have a referendum, a statewide fight now that will be on the ballot in November of 2022 of this year. So we're gearing up for that. So we are giant slayers. I'm going to go quickly because I know I need to wrap up. So we actually are suing the FDA about their inaction. And our plaintiffs are Action on Smoking on Health, which is on the call with us tonight, the American Medical Association, and the National Medical Association. So that's our nation's doctors suing the FDA in an administrative lawsuit about their inaction about menthol. So in the meantime, we keep going. So the FDA has actually said that they will begin, as Dr. Ziegler said, they're supposed to April this year, a few months, and now begin the rulemaking process to take menthol and the little flavored cigars and cigarillos off the market. So that I didn't really have a chance to touch on that, but along with the menthol, little cigars were left on, which are very much smoked by Black and brown young men, knowing that it would take all these years to do anything about it. So here we are. And that also is going to be, those are supposed to be taken off the market as well. So we know the rulemaking process is fraught with, this is something else that I should have taken out, is fraught with interference and industry interference lawsuits. So we're not expecting anything, but our lawsuit is still in place. So we are expecting them to begin it and we're going to stay over them as much as we can. So when we're talking about tobacco control, we know that it has to be more relevant than ever. These are just some of the issues that our communities are facing all the time. COVID, which is not over, dismantling racism, police reform, undocumented community members. The first dreamer actually was from Illinois. I don't know if you all know that. It was not from California. Our political instability, and just our poor young people who are growing up. So we want healthy communities to facilitate the individual's ability to make a healthy choice. That's what it's about. This is the Titanic, is going down, and we want to have lifeboats for people. We want to get them off of that ship. And that these are all of the things, the lifeboats that we have. So building community capacity and building engagement, we are the lifeboat. So this is some of the resources now we have in California. We passed a wonderful tobacco tax, and we have resources now to really have leadership groups in our priority populations that can really get in there and know how to engage their people. So we know that passing laws to protect Black people, that marks the beginning of change. It's not magic. So we need health equity reparations. We need all of our community members supporting smokers. We need culturally tailored smoking cessation that addresses social determinants of health, stress reduction. We need innovation, and we need total rejection of the tobacco industry. And I'm going to end with this. We had passed the Voting Rights Act in 1965, and we're still fighting that fight. And so I'm not, it's not going to be magic when these laws are passed. We have to engage even more, not less. It's not just winning the fight and getting a bill passed. It's about digging in and doing the work that it takes after the bill is passed to really make a difference. So there's our Stacey Abrams. who was denied, the governorship in Georgia, and she went on, she kept fighting. So we keep fighting. I'm encouraged. I got some rest during COVID. I'm ready for our referendum, and it's on in California, I can tell you that. So thank you.
What a message, Carol. We really appreciate that. And we understand you'll be able to stay on to the end of the program for questions and answers.
Yes.
So following that challenging message, let's go local. I'm honored to introduce two of my wonderful colleagues, Ms. Kristen Meyer from who is the Community Health Specialist for the Evanston Health and Human Services Department, and Ms. Ria Kataria, Prevention Specialist for Peer Services. Kristen and Ria will now give Evanston's tobacco landscape. Let's listen to how the national trends Carol described are playing out in Evanston, and how continued tobacco marketing and availability are literally unraveling our hard-fought progress on reducing tobacco industry-induced dependency and premature deaths. Kristen and Ria, the floor is yours.
Thank you so much, Don. Okay, and we've got the slides up. So I am Kristen Meyer from Evanston Health and Human Services Department, and we're going to share a little bit of local data just to kind of drill down from what Carol so eloquently talked about kind of happening on the national landscape, and really see how some of those trends that she spoke about are playing out here in Evanston. So we'll show you some local data. First, this is a map of current cigarette smokers by census tract for our city. For those not familiar with census tracts, it's a way that the U.S. Census and the government kind of divides up neighborhoods so we can compare from neighborhood to neighborhood. And so one thing we see when we look at this map is that smoking behaviors are not consistently dispersed across the community. In the US as a whole, we have about 14% of our adult population smokes. In Evanston, on average, we're a little bit lower than that, but you can see as you look through this map that there are communities where we have higher than the US average for smoking for adults. And you'll see in this next map that the places where smoking practices are the highest was perhaps not an accident, because what we see in this map is both the distribution of Evanston's Black population and also the distribution of Evanston's tobacco retailers. And so this is work that me and my colleague Ria Kataria have done to really show how there's predatory practices right here in our town. The neighborhood level availability, as Carol spoke about in San Francisco, is also present here in Evanston. So this is a map by ward. We have 9 wards in Evanston, and when you see the shading and the percentages represent the proportion of that population that is Black. And then these Black dots represent our tobacco retailers. So what we see when we look at this map is that these dots are disproportionately located in the communities with the most Black residents. So, of our 9 wards, the 3 wards with the highest proportion of Black residents, over half of our tobacco retailers are located there. And the areas with the highest proportion of white residents, we see the lower representation of tobacco retailers. And so again, that predatory marketing, locating cigarettes where Black folks are, is also very much playing out here in our town. Another part of kind of the local research that we've done here in Evanston is trying to understand how prevalent menthol and other flavored tobaccos are. And there's just not a lot of great data. And so we've had to kind of be scrappy and collect some of our own. So Ria and I conducted a survey of all the different tobacco retailers in Evanston, at least that would agree to speak to us, to determine what proportion of their sales were being made up of flavored and menthol products. And so based on the survey, we had about 25% of our tobacco retailers agreed to speak with us. And for the ones that did agree to speak with us, they estimated that about probably half of the products that they sell, about half of the tobacco products they sell were flavored tobacco, and that maybe about 30 to 40% they estimated were solely from menthol cigarettes. And so this does make up, again, by retailers, perspectives, makes up a really significant proportion of the tobacco sales here locally. And they also did say, that were we to ban flavored tobaccos, that they, that it constitutes a very important part of their business, and that they might not be able to sustain their business if we did ban those products. So that just speaks to kind of the level of economic activity that these products generate. I'm going to pass it over to my colleague Ria to talk a little bit more about this.
Thanks, Kristen. Hey, everybody. So let's jump in and talk about some more recent data that we collected by conducting retail audits in Evanston. We managed to collect data in 26 willing retailers or stores out of the total 34 stores in Evanston, so about 76% of all stores. The main question we were looking to answer with our data is whether or not flavored tobacco is more accessible, heavily marketed, or disproportionately advertised to communities of color in Evanston. At each store, we looked at flavored product availability. So if they sell a particular product in flavors, or presence of any discounts on flavored products, if the retailer was being paid to advertise flavored products, and if there were any significantly cheap flavored products available, like a $1 deal. And when I say flavored products, I mean everything from cigarettes to cigars to chewing tobacco, cigarillos, little cigars, vapes, e-cigarettes, all of the above. So we went ahead and did plenty of descriptive analysis on the data we received. Delving in detail into that would take up a whole nother hour. So just a quick summary of what we learned is, so we gave every retail store 1 point if they had a particular disturbing measure present. So if one store had an advertising for a flavored cigarette product, that store got 1 point. And then if they also had a discount for the flavored product, it got another point, and so forth. We added up all of the points and divided them up all by ward. And what we see is disturbing because it was a common trend in a lot of the data, and Kristen talked about it earlier too. And we also see it like countrywide, that wards 2, 5, and 8 with the highest proportion of Black population, they show the highest number of points. So not only are the retailers concentrated in these wards, but they also have flavored tobacco presence. And why this matters is super simple. It matters because research has previously shown that proximity to substances coupled with higher availability, marketing, and discounts all lead to a more willing consumer. So you're simply more likely to buy and therefore use a product if it's closer to you and it's marketed to you. Which brings me to an audience that we have been concerned about, not only locally, but throughout the nation. And I just included a picture of a tobacco ad next to a Jolly Ranchers ad in Evanston, in a very busy street in Evanston. So youth were at the precipice of change with record low tobacco use rates year after year in Evanston. We recorded less than 5% of youth users each year until the use of vapes pushed the use to 17% in 2019. With good prevention and education, those rates are also falling, but it is still a vulnerable population, especially to disposable, cheap, and flavored products. Majority of youth who use reportedly get their products from stores or a friend, a trend that has been consistent within Evanston youth for years. With the abundance of flavored tobacco in the media, advertising the community and availability, regardless of its legal status, the youth are a population that need to be protected from big tobacco practices like they used to be in the past. I'll pass it on to Kristen for just some community action points that we can work on as a community.
Yeah, thank you so much, Rhea. So Rhea and I are going to talk about kind of what we can do here in Evanston, both policy-wise and then also kind of at the individual and family level. So in terms of what we can do at the city level, again, Carol spoke, really extensively about some of the national leadership that we've had from, San Francisco, and, Don spoke to our past leadership on this front in Evanston. So in terms of where we can go from here to further strengthen our tobacco policy locally is we could ban the sale of flavored tobacco products. And importantly, if we did that, we would make sure that it isn't just flavored tobacco exempting menthol, but that it would be really inclusive. We could also increase taxation of flavored tobacco products such that it discourages youth from initiation because they're our most kind of price sensitive consumers. Also increase tobacco licensing costs, making it harder for retailers to, or making there less of an incentive for retailers to sell cigarettes. Of all of these, obviously banning the sale of flavored tobacco would do the most. And then further, another thing that we can do in Evanston is to really strengthen our indoor air quality ordinance. So Evanston has historically been a leader on this front, but there is certainly, ground that we can continue to get where we still have people that are being exposed to secondhand smoke when they live in apartments, when smoke is coming up through vents. There's nothing that our current ordinance can do about that. So one potential avenue for Evanston is to really give that a lot of teeth and see if we can get, smoke-free multi-unit housing would be, I think, a great goal for our city as well. So those are just a couple of the potential policy levers. And, when we get to the audience portion, we'll be curious to hear kind of the group's thoughts on other things we can do, or which of these kind of are creating the most excitement among you all. So I'll pass it off to Rhea to talk about kind of individual actions.
Yeah, just as a closing point, individually, I think it is a community's responsibility to be aware and educate their peers about the problem of flavored tobacco, and as well as support them and direct them to resources when they need help instead of having so much stigma that surrounds them. Parents and guardians especially need to have engaging conversations with their teens about drugs and listen non-judgmentally to what they have to say. They also need to set realistic boundaries around drug use with their teens. Our research in schools have shown that students whose parent or guardian has set clear rules about use and have spoken to them about drugs in the past 12 months are more likely not to use drugs, and those students also are more likely to perceive these drugs to be harmful. So I think that's all I can say for now in terms of making it really short. We'll pass it on to audience sharing questions, so feel free to put anything in the chat.
You can unmute yourself if you have any questions.
Thanks, Kristen and Rhea. Carol, there's some discussion in Evanston of opening up hookah bars. Could you discuss that from your perspective?
Sure, I forgot to put that into my presentation.
That's all right.
So hookah is taking off like wildfire across this country. Hookah was exempted from our California state law. As you know, when you're making a law, it's making sausage. And that was one of the things that we did not agree with, but we had to, get it done. And we are actively going after hookah now. a lot of our young people and college kids are smoking hookah. My daughter is in Atlanta, Georgia, so all of the Black clubs and even restaurants, it's hard to go without people smoking hookah, and they seem to think that it's kind of harmless. So it still is nicotine, it still is secondhand smoke, it still is lighting coal inside an enclosed area, which gives out carbon monoxide. So just how it violates indoor air laws, which in California we have very strong ones, is just incredible to me. They're very organized. They come and they position it as a cultural tradition. So it makes people feel like they're racist if they go against it, when in fact, it's about money, it's about big business, and it's about these products are proliferating all over our country. And so we are firmly against having hookah. If you want to get a hookah and have some tradition in your own home, help yourself. But if you want to get out and sell it and addict our children and young people, then that I'm not for that. I don't agree with that. And so we have some actual webinars on it. We have a YouTube channel, African American Tobacco Control Leadership Council, Saving Black Lives. And we've done webinars about the cultural manipulation with Arabic, Middle Eastern scholars who just denounce and demystify this whole cultural thing that people are saying. People who are making money are saying that it is, when it is really not. And it's also in Africa, in Mexico. I've heard people at weddings and people do it with their kids. They just don't seem to get that it is addictive and it is very harmful.
Okay.
Hey, Don, and everyone. This is Alex Meister from the American Heart Association. Great presentations, and hearing about Evanston's role in tobacco, and thinking back to Evanston being, the first unit of government in Illinois to pass T21. I mean, more than a full year before anyone else got on board. I'm wondering, for those of you, Don, I know you were in that fight, but for those of you in Evanston that were kind of part of that, how do you see flavored tobacco now paralleling where T21 is then? Because I'm sure that, if you ask 100 people in Evanston, what's your top public policy priority for next year? Probably not too many are going to say banning flavored tobacco. But I bet not too many said, raising the tobacco purchase age to T21 back in 2013, 2014. So I'm wondering if this kind of mirrors where we were, and if really we're at a point where we need to be kind of proselytizing this a little bit more. But do you see any parallels?
Definitely. When we proposed Tobacco 21, it didn't happen overnight. It took a while, even in Evanston. So I think, and what we're trying to do tonight is present the information that we have about these products in Evanston, and have national expert like Carol give the national perspective as a way of bringing more awareness about these issues to our policymakers, and involving the minority community, particularly because so many are the target marketing of these products. So tonight is the beginning of our effort, and I think maybe there's discussion in tobacco control of the end game, and I'm wondering if Carol could describe what that means and what the movement is, because we don't allow lead paint sales in Evanston. We have a lot of other products that we don't sell, and yet we sell something that kills half the people that use it as intended. And so Carol, could you discuss?
Yes, so in California now, we are playing what we call the end game, and the end game is that we have declared that by the year 2035, we will have zero smoking and vaping prevalence in the state of California. And we actually were on target for that before vaping hit us. But we are, that's being infused in all of the work that we do. And it's, so there are different ways to get there. So one way is New Zealand, and I'm blanking on the city that's in Massachusetts. I think it's Brookline, that have enacted laws where, after a certain year, you can never legally purchase cigarettes. So you keep raising the year that you can buy it. so that you're letting the people who are addicted continue to buy, but you're phasing it out. And so we're actually working on how we're going to frame that. And so when we say the end game, that people can wrap their minds around better phasing it out rather than you're just going to kind of abruptly stop. But of getting the idea that it is possible. And so many things. I have a presentation on it. I never thought that Nelson Mandela would get out of jail, let alone become the president of South Africa. I worked on apartheid. As protesting it as a college student, and then one day he was out of jail. I never thought we'd have a Black president twice. I never thought the wall would come down in Germany, and East Germany and West Germany would be united, and now look at them. Yeah. So just slavery, child labor. So the things that you can't imagine that first of all, we have to believe that it's possible. And then we need to go about the business of making it happen and educating people, and that we can't, as a society, continue to sell a product that kills half the people that use it and addicts a new generation. So, and how we've been playing checkers with our little grants, you have a 3-year grant, a 5-year grant, you're getting this law done, and they play chess. So they're looking at the long picture all the time. And the end game is about us as activists, as public health people, of looking at the long game. And even though I might not be here because I'm not going to work forever, but we're working and grooming people who are going to take our place and who are going to keep going with that vision in mind, that goal in mind of ending it.
So it appears that there are a number of options. One is not to do anything. Another is maybe a banned flavored tobacco. Another is maybe raise the purchase age. So every year you have to be, so some communities have said, okay, now we have tobacco 21, and then it'll be the next year. So we keep aging it out, and that might be the softest way to, with respect to the business community. But a couple communities in California have actually banned tobacco products entirely. And I don't know, Carol, if you want to mention that, or maybe Chris.
Well, I know Beverly Hills has, and we worked on that. I think they just allow high-end cigars now and some tourist stuff because they have a lot of tourists, but they actually have banned the sale of tobacco products in Beverly Hills, and we went down. I think Chris Bostic was down too for that, some of that. And very exciting. So here's how race plays again, because LA, which I grew up partially there as well. If I go to Compton or Watts and say, well, Beverly Hills did it, well, what are they going to say? Well, we're not Beverly Hills because Beverly Hills doesn't have the police issues that we do. So that the race and our whole fabric of our country comes up over and over and over again. But that is something that we want cities to do. So some cities can begin doing that. We know that tobacco control is grassroots. It's city by city. So what you do, you think in your little city, and they're going to say, oh, well, they're just going to go to the next city and get it. Or they're going to go now, we have states. They're just going to go to the next state and get it. But we're going to get that city too. And we're going to get the whole state. And that's the success of our movement. And so we shouldn't be afraid of that. And when we're dealing with our elected officials, they shouldn't be afraid of that. As Don said, you want to be the first? Don't you want to lead this, to be at the head of this, and to have the other cities come after you? And they are coming. We're seeing it all over. And because we can zoom in, we're zooming in different municipalities all the time. And it's happening big time all over this country, and it's wonderful to see.
And Chris Bostic just mentioned Manhattan Beach also banned the sale. Manhattan Beach, California.
Thank you, Chris. Chris always has the facts.
When we passed tobacco 21, it was my feeling that's probably low-hanging fruit. I mean, it's very easy just to change the year from 18, or the age from 18 to 21. It's just change a detail on all the tobacco laws you already have. What's your estimation of what's the lowest hanging fruit in this? Is it banning the flavored tobacco? Is it just constantly raising the purchase age? Or is that going to vary?
Ban the flavored tobacco. That's a big piece of this. But we do everything. So if I would put my energy into banning flavored tobacco with no exemptions. And that every, city by city, and other cities will follow. And you'll hear as well. So, well, we changed, we raised the age to 21. So now we don't need to do anything else because, and even when they could see 21 was going to happen, they started saying that themselves that, okay, like that's going to be, that's going to solve this. And then you get into, well, adult issue, that adult choice and that, and they get into, are they getting it from the stores or do they get it online or do they get it from their friends? And so the store is a vector. It's advertising, it's normalization of a deadly product. That's what stores are, along with a source of the product. But they're also, even more critically, they are the vector for, even if they didn't sell the product, that they just had all the advertising that they have to normalize it, that would still be harmful to the community. If you look at it that way, it's what you're coming in as a kid seeing every single day. When you're buying all those other products that aren't good for you, that this is what I do when I get to be a certain age. And I was watching the series, The Chi, and it's just smoking, which I really enjoyed. It's smoking throughout. People are constantly smoking all the time in that series, pot and cigarettes.
Yeah. Chris Bostic of ASH put in the comment section that the communities in California that totally banned all sales, before they did that, they banned flavored products. So the first step was banning flavored products.
Yeah.
There's also two articles that were linked in the chat box as well.
Okay, good.
Are there any more questions for Carol or anyone on the panel here, Kristen or Rhea?
No, I'll just say one more thing for the article I tossed in the chat there. There are a couple within the last 12 months of cities, some with pretty similar profiles to Evanston, like Bloomington, Minnesota, which is kind of a similar suburb of the Twin Cities there, that were able to get this through. I know for a long time this has been kind of viewed as it works in California and Massachusetts, but it's hard to replicate anywhere else. But we're seeing similar Midwestern states start to do it, and then cities there are kind of rolling, just as we saw with T21 here and elsewhere. So would love to see Evanston kind of reprise its role leading that for Illinois.
And you're talking about banning flavored tobacco products in Minnesota there?
Yes, indeed.
Okay. Any other comments from people in the community? What do you think would fly, and how do we pursue discussion of this in Evanston? Kristen, could you speak to the grant you have from the Illinois Department of Public Health and how this discussion fits into the grant that you have?
Yeah, absolutely. And while I do that, Rhea, maybe if you want to share the slide with my contact information, because one thing that we're hoping to do tonight is to really, if you think that what you've heard is powerful and you'd like to join our coalition and be involved in this effort, we would love to have your energy. And so you can email me and we'll get you involved. And so right now, the Evanston Health Department does have a grant from the state of Illinois to, first of all, enforce our existing kind of clean air ordinance, but then also to see if we can, strengthen our tobacco enforcement practices and policies here locally. And so the work that we have been engaging in is really trying to gather the data that Rhea and I have talked about, and then, try to build momentum and interest in really pursuing this here locally. So again, please join us in this fight.
Interestingly, Chris Bostic of ASH put a note in the comment section that Bloomington, Minnesota is also phasing out tobacco retail licenses. So eventually there will be 0 licenses. So that is another option.
We have a
I see,
question from
yeah,
Ms.
C.
Brown.
Louise Brown.
Yes, no, and my question is probably really, I'm interested in what is hookah? Could you explain to us what that is? So if we see it, we can recognize it. Okay.
You want me to do it?
Go ahead, Carol.
So hookah is, I'm not sure where people say that it comes from, but I saw it in Egypt as a young traveler, and I would have tried it, except there was mostly men and it just looked so dirty. So it's very exotic. It's a water pipe, and it has these plastic tentacles that come off of it so people can smoke it communally. And so what I've seen is either they'll have individual hoses that come off of it, or they'll have, each person will have their own mouthpiece that they can put on. And now with COVID, but you light charcoal that heats it. So it's like this whole ritual that and make it kind of fancy. And then people are there and they're just kind of smoking and pulling on it. And you can also put marijuana in it, I've heard. I've never seen it personally. And so it's in restaurants, and they're hookah bars. So there's different flavors. So they talk about that all hookah is flavored. So that's why they don't want the flavors to be, prohibited. But some of the flavors are Sex on the Beach and all these, sexy names. So it's not like apricot or plum or something when you think of an exotic Middle Eastern flavor. It's very much modern. So their argument is that the hookah pipe is not something that kids could smuggle into school, because, with vaping, all the kids were doing it in the bathroom, that it's something that's a part of their culture. It's peace. It's offering people something when they come to your home. That's what they say when they go before city councils. But in reality, they're hookah bars near all the college campuses. And it's just something that's very, it's exotic. And so you can see how young people would want to give it a try. And so go to YouTube and put hookah in, and you'll see. So, and that's where if you're providing testimony, tell the city council people to go to YouTube and put in hookah, because it's all the kids showing you how to do it, how to blow the smoke, how you can add things to it, the deep boxing, what they call it, where they take it out of the box and put it all together. And it's all of our young people that are doing that. That's the biggest market of it.
It's very popular to sit around the hookah and puff together. Problem is, when people typically smoke a cigarette, it's about 20 puffs on a cigarette. But a normal hookah session might be 5 to 10 times that puffs. So the amount of contamination from the tobacco, from the smoke, is multiples of just smoking cigarettes. Besides the environmental smoke of people breathing in this, they have to work in that setting.
Thank you.
And when I go out, since it's so much more and more in Atlanta, I finding it harder and harder to go out. So the next day I will lose my voice. I really will feel it. So it doesn't have the heaviness of cigarette smoke. It's a lighter smoke, and it actually smells kind of, like flavors, but it's very much, you can definitely feel it in your body, in your throat. Then if that night or the next day, I will lose my voice when I go out there. I can definitely feel it. And so for workers, for everybody, but for the people who are working there, I just don't know how they can get away with it. And when they provide that, it's so emotional that it's facts and data have nothing to do with the decision to exempt it. It's all about their lobbying, very strong lobbying.
Okay, thank you.
Any other comments, questions? I want to thank Carol McGruder for the superb presentation, taking extensive amount of time, and for her colleague calling in from from the Middle East.
Thank you, Dr. Bell.
Yeah, and Kristen and Ria for their fine presentation. So we have some issues here in Evanston. We've got issues. I think we have a history of proactive action on these topics. So let's have Evanston not only deal with the injustice through reparation issues, but also maybe some policies to end tobacco use in our community and be a leader in the state of Illinois. Any other comments, questions? I want to thank the Evanston Public Library and Irene Williams for coordination on this. If no further questions.
And just thank you, Dr. Ziegler, for your historic leadership over the decades with tobacco in Evanston. So thank you so much for leading the charge on this for so long and for continuing to be so passionate about it.
Can't stop now, Kristen, Okay. Hey, any other comments? If not, want to say thank you for participating. And Irene, how can people see the recording?
Well, hopefully we can have it uploaded by tomorrow. I will email it to all that participated in this evening's program.
Okay, and also it will be available through the Evanston Public Library website?
Through our YouTube channel.
A YouTube channel, okay.
Yes, yeah, we have a channel.
Okay, wonderful. Okay, any reason to continue? People are saying it's very informative. I hope it was a good use of your time. Thank you, folks, very much for taking time, and to be continued.
Thank you.
Thank you.
Yes.
Thank you
Thanks,
very
Carol.
much.
Thank you. Take care, everyone.
Yeah.
Thank you.
All right, bye-bye.
Yeah. Thank you very much.